I'm Chair of Gloucestershire Health and Care NHS Trust. It's my pleasure to welcome you all to the meeting this evening. I just wish that we could be meeting in person, but events have really conspired against us this time. We were planning to hold the meeting at the university's Oxtalls campus, but with the advent of the Queen's death and then the period of mourning, we weren't able to do the usual comms that we would have done. And in the end, it just seemed more sensible to revert to an online meeting. So hopefully next time we will be in person, but for today, welcome to the good old Teams screen. So as we approach our third birthday as a trust, I would reflect that this has been yet another year of momentous events for our trust, for the country, and indeed for the whole world. And it seems that each of our 3 years in existence has had its historical landmarks, and this year is certainly no exception to that. So first of all, of course, we've had the ongoing pressures associated with the pandemic, its impact on services, on the demand for those services by people that we serve. And of course, we've continued to depend immensely on the goodwill and resilience of people in our trust providing those services. Secondly, there's been major legislative change, which has underpinned the statutory introduction of integrated care systems and the Integrated Care Board, highlighting the importance of cooperation and collaboration between health, social care and other partners to meet the needs of people that we serve, both here and now and in the strategic longer term. And thirdly, the context of our world is changed by the tragic events in Ukraine and the impact of that war, both on fuel prices and the cost of living, alongside other factors too, of course. But therefore, new Prime Minister and new government stepping up to try and address those very enormous challenges, which will impact on every single one of us, but most of all, of course, on the most vulnerable people in our communities and many of those that we serve. And then finally, and most recently, of course, the death of Queen Elizabeth II and the accession of King Charles III. A real watershed moment in history that I'm sure we're all reflecting upon following yesterday's funeral. And yet, and here I want to quote one of my favourite poems by Gerard Manley Hopkins. And yet, for all this, there lives the dearest freshness deep down things. And I think we will see that dearest freshness in the perennial care, compassion and commitment of our colleagues across the trust to the work that they do and the people that we serve. I think we'll see that dearest freshness. It's evidenced in our very good CQC report, which we'll be talking a bit about later. And that dearest freshness is nurtured by the way that we work to co-produce what we do with the people and communities that we serve and with our partners across the county. And so today we're going to demonstrate some of that freshness in our AGM reports to you, and we'll look forward to having dialogue with you. So as always, you know, we're against the clock, but we will pause briefly between presentations, and we have allowed a goodly time at the end if you can bear to wait that long. So I'm going to, at that point, hand over to Paul, our Chief Executive, to give us his overview of the year. Thank you, Paul.
Thanks, Ingrid. It might be worth just having a quick look at the agenda, just so that everybody knows the way that, there we go. So the agenda for today set out there. So I've got a relatively short time to talk about the overview of our year before handing over to Sandra to talk about finance, and John to talk about quality, and then our update from the Council of Governors through Chris, and then, as Ingrid has said, time for some discussion. If we could move on to my title slide, thank you. So can I add my welcome to all of you? It's good to see all of you here. My name is Paul Roberts. I'm the Chief Executive of the Trust. There are lots of familiar faces on this call, but not everybody I will know or will know me, so that's who I am. And it's good to see that we've got representatives of patients and carers and community representatives, partners, colleagues and governors, as well as the board here as well. So welcome to everybody. And I suppose my difficult job in a very short period of time is to represent all of the hard work of our well over 5,000 colleagues over the next few minutes. And in the short time I've got, it's really hard to do it justice. But one of the things that is sort of a formal part of what I'm doing is introducing the annual report, and I'll hold the cover up. But the annual report is online, and there is a lot more detail in the annual report. So I'm going to skate over the surface. But if you want to look at all the detail, there is a lot of material in the annual report. So I'm going to start off by just giving some basic overview of the organisation, because there's a lot of us at this meeting who are obviously involved on a day-to-day basis and know a lot about the organisation, but I know there'll be people here who come into contact with it but won't know it as well. So here are just some facts and figures. We're a large organisation. We've got nearly 5,700 colleagues. Very diverse team in every meaning of the word diversity, different roles, different professions, people drawn from different communities. It's an incredibly wide-ranging and expert workforce, and one we're very, very proud of. Sandra is going to talk a bit more about the money, but we spend £250 million pounds a year, so a lot of taxpayers' money is used to fund the services that we provide. If you look at the bottom of this, you'll see that we're a very, very busy organisation. Every day, on average, we get over 1,000 referrals into our services. 1,000 referrals every day on average. Imagine that's a huge number. And in terms of the activity that we do, over 3,000 patient contacts on average every day as well. So it's an incredibly busy organisation. You'll see in the bottom right that it mentions our annual report that I mentioned a couple of minutes ago. So please do look at that, because there's a lot of more detailed information there, as I said. If we move on to the next slide, please. Again, it's really hard to sum up what we do. I mean, most of you will be well aware that we are what we would call ourselves a community mental health and learning disability trust. So we provide, mostly what we do is we provide services to people in the community, general services in the community, specialist services to people with mental illnesses and mental health problems, and specialist services to people with a learning disability, and that's at all ages. So that, on one level, that's what we do. But when we break it down, we actually break it down into 106 services. And of course, this slide, those of you who are quick at counting, has not got every service listed, but we tried just to summarise them there and do it in a set of headings. So some of our services on the left-hand side are provided in hospital and inpatient care settings. So we've got a number of inpatient units. We've got our 7 community hospitals. We've got our 2 large mental health units in Charlton Lane and Wharton Lawn, and our 2 smaller ones in our recovery units. And we have our learning disability, very small unit in Berkeley House. But we're a community organisation because we provide very great deal of what we do in people's homes or in other community settings, you know, closer to people's homes. So the next column just gives some of the examples of those mental health services at the top, and then the learning disability services that we provide to people in the community. The next column is about those community physical healthcare services. So those services which are providing support to people with mostly with physical healthcare conditions in community settings as well, including some very specialist services like, to name one, the Sexual Assault Referral Centre provides a very specialist and important service for people in the county, as an example. And then on the right hand side, it lists some of the particularly specialist children's services we provide, which cover all of our the groups that we serve, physical healthcare, mental health care, and there's quite a lot in here which is about public health too. It's about supporting families and children at school, as well as providing our immunisation services and things like that. So it's not all treatment, some of this is public health. That's a really quick whisk over a lot of complicated services in the Trust. So if we move on to the next slide, at this meeting today, we have our board members present, and so I'll just say something very brief about the board. Our board, through our chair, Ingrid Barker, who has already introduced herself, and our non-executive directors, who are at the second row, starting second from the left. Or sorry, third from the left with Marcia. Those are our non-executive directors. We're accountable to our Council of Governors and therefore our members through our chair and our non-executive directors. Chairs and non-executive directors are not full-time employees of the organisation. They're there to represent the community, and they're there to have particular expertise which they can bring from different sectors to help us with our deliberations and our decision making as a board. And then the other people that you can see on here, from me at the top across that top row to Neil. Actually, Nicola's one of our non-executive directors as well, and then Angela and Helen at the bottom. We're executive directors, so we work for the Trust as directors. We're full-time employees, and we have our areas of functional responsibility. Seeing Nicola on this chart, just to mention, we're reporting on last financial year, 21-22. It's always odd to do that in September because it seems like history in a way, but during that year, Nicola has joined us since the end of that year, and we had a non-executive director called Clive Jadani, who was with us briefly last year, who Nicola has replaced, but he's mentioned in the annual report. We also had two executive directors that worked with us for part of the year, covering the operational role, John Campbell and Hilary Shand. I mention their names because they should be taking credit for some of the things that have been done in the organisation, and David replaced them when he joined us in January. So that's our board. We move on to the next slide. Many of you know we merged from two previous organisations, one together, which was the Mental Health and Learning Disability Trust, and the other Gloucestershire Community Services, which was a community physical healthcare service. And when we merged, we thought one of the most important questions to ask was not just what are we going to do, you know, what services are we going to provide, what are our plans going to be, but how are we going to do it? How are we going to run our organisation? What ethos, what culture are we going to generate? So we actually asked about over 2,000 people to what their views were, and we collated them. And just before we merged, we established these 4 values, which have a lot that lies underneath them, as you can see from this slide. So what we felt was important to us as an organisation, or what those 2,000 people told us, was working together, a focus on always improving, making sure that we are respectful and kind and advocate for the people that we serve, and that really importantly we make a difference. And these values lie at the heart of how we try to operate as an organisation, as a board, as executives, but also all of our colleagues in the day-to-day work that they do as well. They're important to us. So if we move on to the next one, but because of course it's not enough just to have a culture and a way of operating, an ethos, if you like. There needs to be a structure behind how we plan. So we also have a strategy, And therefore, every time that we produce an annual plan of what we're going to do in that year, or we produce a business case about an investment we want to make, or a building we want to build, or a refurbishment we want to undertake, we need to make sure that that is in line with our strategy. Our strategy has a mission, which is enabling people to live the best life they can, and a vision, which is working together to provide outstanding care. And we have four overarching strategic aims: to provide high quality care, better health, including tackling inequality, to be a great place to work. We think that's a fundamental objective for an organisation of our size that is so much part of the community, and to be a sustainable organisation as well. So every time we put plans together, when we look at how we're performing, this is the framework we use for the way we plan. And of course, we do that as part of an overall system. So we're part of the integrated care board and the integrated care system. So we need to make sure these things, as we do them, are adding value to the whole health and social care system. We move to the next slide. One of the particular pieces of work that we did over the last year, we decided to do this when we were approaching our merger, but with all of the priority that tackling the pandemic took, it took us a while to establish our plan, but we've developed a working together plan. And the way I would describe this is we said right from the outset that involving people in how we design our services and how we operate them, people who use them or people who care for people who use our services, was fundamental to our philosophy. And our board wanted to have a direct line of sight on how we did that. So we have a working together group which reports directly to the trust board, and its job is to make sure that through our services we involve the people that use them properly. And in some services, often mental health services, there's a really good history of doing that. It's been part of the culture of good mental health services for many years, but it's not been quite so much part of the culture in all services over the years. So we want to make sure that's evenly spread right across our organisation. So we've got work to do on that, but we think that's an important part of our strategy that we really worked on over the last year. I know I'm going at a pace, but I've got a few things I want to get through. So if we can move on to the next slide. This is quite a busy slide, and I know you won't be able to see all of this, but I thought it was just quite useful in trying to get the context of what it's been like as an organisation. Ingrid mentioned earlier that we had our CQC inspection report last month. What I wanted to talk about was really what the journey's been for us as an organisation since our previous CQC inspections. So if you look on the 2018 column, April 2018, the old GCS Trust received its CQC report, and then in June, only 2-3 months later, Together received its CQC report. So in essence, we've had around 4 years between those reports of our predecessor organisation. So the one that we just had was the first one for our new organisation, and what a few years that's been. So throughout 2018 and into 2019, up till October 2019, which is about halfway down that 2019 column, we were going through the process of consulting and involving lots of people in making our plans for our merger, and we merged in October 2019. So we all sat back in 2019 and said, phew, we finally got together. We've got lots of ambitions, and I'll talk a little bit about what some of those were a little bit later. We know what we want to do. We think we've got ways of working as one organisation which can improve them. You know, we can now set off on that road to do it. And unfortunately, we started getting news out of China about 2 months later of a virus that seemed to be becoming a bit of a problem. And therefore, within 3 or 4 months of being a new organisation with lots of ambitions and plans, we were in pandemic management mode, which was a huge impact on all of our services, all of our colleagues. And you can see in the 2020 slide right through into the 21-22 column that we were in pandemic operating mode throughout much of the first 2 years of our operation as a board. That involved complete redesigns of services, operating them in a different way, doing them more safely and more securely, much more difficult to do them. And I think colleagues will also be aware that since we came out of pandemic mode formally back in March, when the Prime Minister announced moving to a post-pandemic mode, that NHS services have continued to be under a huge amount of pressure. You read it in the papers every day. I think we're told that the Prime Minister or the Deputy Prime Minister might be making a statement on the NHS in the next few days. And we know that the NHS is under a significant amount of pressure. So it's been a very, very operationally pressurised couple of years since we merged. Well, 2.5 years in terms of the period we're talking about here. And I would just say our colleagues who have been dealing with this have done so absolutely magnificently. So in a way, that was a lead up to me saying what an unexpectedly complex time we've had since we merged into one organisation. We weren't expecting what happened. Nobody was, I don't think. So it's been a very sort of tough introduction to the new organisation. And then, of course, this year we had the announcement that the CQC were coming to do our inspection. And if we move on to the next slide, delighted to say that we were very, very pleased with the CQC inspection outcome that we received. We had good in every domain. The CQC, just in case you're not aware of them, they're the external quality regulator of the NHS. They did a very comprehensive inspection of many of our services, and this was their overall rating. These are the domains they look at. And in case you're worried about the requires improvement one, John may well be talking a bit more about this later, but it largely relates to some quite specific improvements that we need to make in inpatient mental health services. Most of our services were judged to be good in terms of the safety domain as well. So I think colleagues can be reassured. And what I would encourage you to do is read it. You can go to the CQC website, you can use their search engine, you can find the CQC report on the CQC website. Have a read, because I think it gives a lot of assurance about our services. Not uncritical. You wouldn't expect that to be the case, but it's a good and very positive external assurance of the services of the trust, and that's due to 5,700 people that work in our organisation, and I think they've been astonishing in the difficult circumstances that they've been operating in for the last 2 or 3 years to produce results that the external regulator was so pleased with and complimentary about. So if we move on, that I guess brings me to one of the other major external judgments we get. So about this time of year, there is a very comprehensive survey of staff right across the whole NHS, and every NHS trust and organisation has to take part. Well, again, we were really pleased about the outcome. So the outcome was announced in March 22, although the survey was done in 2021. And what this shows you are the key 9 themes that they look at in the staff survey. So things like staff engagement, morale, we are a team, we're always learning. You can read them for yourself. And those tell you that of those 9 themes, 7 of those key themes we scored above average within the NHS as a whole, and in some cases quite well above average. There are 2 themes where we didn't, and we're slightly below average, and therefore we know we've got work to do. But we felt quite vindicated in the hard work we've done to try and support colleagues you may recall that I mentioned earlier, one of our strategic aims is being a great place to work. We think this demonstrates that whilst we're not there and we're not perfect by a long way, we're on that journey to be a great place to work. And the next slide, which is really busy, but I'll explain how to look at it, just gives you an idea of how we've done as an organisation compared to others. So if you look at that big, don't read the detail, there's no need to do that. But you can see there's a column fourth in from the left, which I think I'm colourblind, but I think it's blue, is it? It's something like blue. And that's GHC. So those are all our scores across those themes. On the left-hand side are the national comparators. So how we compare to the Southwest, how we compare to the benchmark for trusts like us, and how we compare to all trusts. And all of the boxes which are green are the ones that we're doing better than, and the ones that are red are the ones that we're not doing as well as. So there are a couple of red ones there, but the vast majority, if you look at national comparators, we're doing really well. And on the right-hand side, you've got exactly the same analysis, but that's across the 19 trusts, including us, which make up the Southwest region. So we're really pleased that if you were able to take the time and look at the detail on this, you'd see that we're probably ranking about third best staff survey results in the NHS in the Southwest. And we're not competing with other organisations. We hope everybody does really, really well, but we would like to continue that improvement trajectory that we've got. So we're really pleased about how our colleagues feel about working in the organisation. We think it's really important. Ingrid talked earlier about staffing and about the cost of living crisis. There are lots of recruitment issues and retention issues with colleagues at the moment. These things really matter. They're really important. Again, staff survey results are online. They're on the publicly available website. Go and take a look. You can see in more detail what our colleagues think about working in the organisation, and we're hugely grateful to them for that. I'm near the end now, so if we just go through the next couple of slides. A lot has happened in the last year, so here are just a few highlights. I'll pick out three because we haven't got much time. The Trust was named Employer of the Year and won 4 other awards in the Gloucestershire Live Apprenticeship Awards. We think apprenticeships are a hugely important route into healthcare, and our apprenticeship programme has got a fantastic reputation and is an important source of our future workforce. We've also been accredited with the Veterans Aware accreditation. We think being an organisation that supports veterans was really, really important. And if you go to the bottom right column, our patient survey of mental health community services, which again is a national survey, takes place every year, is not done by us, so isn't influenced by us. We were in the top 20% of trusts for 9 of the domains that they took. So again, there's some quite good, in addition to the CQC, there's some quite good assurance in that. You move on to the next slide. We're in a new year. I mean, it's almost 6 months since the end of the reporting period for this annual general meeting. So there's a lot going on this year, which is fantastic. So there was the informal discussion about the opening of the refurbished facilities in Stroud. That's happening this year. Lots of work on the site in the Forester Dean Community Hospital, our X-ray facilities, and we've got a huge transformation of our community mental health services going on, involving a lot of the people that use them. So that's critically important as well. So look, there'll be hopefully a really good report to deliver next year as well. And my final slide, which is again a busy one, but I'm not going to go through it, but I will mention it. When we merged, we've described in our business case for the merger under 4 headings benefits we thought of becoming a integrated physical, mental health and learning disability organisation, benefits for people and communities, for colleagues, for the trusts, the two trusts that were coming together, and why it was good for them and for the system as a whole. There's a lot described in here, which I would love to go through in more detail if we had time. But I would say that there's a good degree of evidence that since coming together in that merger, we're delivering on those ambitions that we set out. So I'm very proud of the work that's been done over the 21-22 financial year in which we're reporting. I think we've made a huge amount of progress. I think we've been able to demonstrate that in some of the external scrutiny that we've been under. And I would just end up by saying this is pretty much the toughest time to be working in the NHS, wherever you work in it, in my 35-year career. It is very, very tough times for people working in the NHS. So I'm immensely proud and immensely grateful, proud of my colleagues and grateful to them for everything that they do every day to produce these sorts of results. Ingrid, I apologise, I've run over slightly, but I could have spent twice as long talking about some of these things.
Thank you very much, Paul. Friends, with the clock in mind, I suggest we do go straight on to Sandra and then take questions later on. So Sandra, over to you for a review of the financial position.
Good evening, everyone. My name is Sandra Bettany. I'm the Director of Finance, and I'm going to take you for a quick run through the year in numbers, and we'll try and keep it as interesting as possible as I go through. If I could just have the first slide, please. So the first slide just shows you how our income that Paul referred to breaks down. Around 82% of our income in the year that we're talking about was from clinical commissioning groups. It says as were, because obviously they've changed as we've moved into the world of integrated care boards. But when you look at that income, the majority of our income is actually for patient care, with a small amount for education and training. And it was an interesting year because the rules changed quite a lot about income in the year that we're talking about, and you'll see that when I come on to some of the expenditure slides. So just moving on, our expenditure distribution, as you can see, an awful lot of our expenditure, around 3/4 of it, relates to staffing costs, including not just wages, but the on-cost, the pensions, the national insurance contributions. So a huge amount of what we do actually relies on the people, and you can see that reflected in the numbers there, with smaller amounts for clinical services and supplies, etc. I'll talk a little bit more about some of the capital charges and depreciation in a moment. So if I just move on to the next slide. This shows a different view of our expenditure. So rather than looking at what we spend the money on, it looks at the services, and these groupings are from our directorates. So you can see how we actually spend the money on direct service provision. As it says on the slide, around 70% of our expenditure is allocated to direct service provision, with corporate services and support services making up the bulk of the difference that doesn't go on to direct service provision. And I said I'd just talk a little bit more about depreciation. So that's the cost of our assets. So that's the annual cost of our capital assets, we call them. And I'll talk a little bit more about capital expenditure at the moment. And PDC that's shown there relates to the public dividend capital. That's the amount that we pay to the Department of Health and Social Care for the use of the assets that we've been given as a trust. So moving on from the expenditure by directorate, we put an extra slide in to talk about the COVID-19 expenditure. In the 21-22 year, around 2.4 million of expenditure was incurred as a result of our response to the pandemic. And it's very similar to the other slide that I showed you in terms of what we actually spend money on. The majority of these headings are around getting more workforce in, either to cover additional shifts, to cover backfill for the higher sickness absence that we experienced in the year, Obviously, there are other categories on here as well. We had the testing service that we mobilised as a result of the pandemic, and of course the vaccination programme where we assisted in the county's vaccinations. So there were additional costs on those two, a huge amount of money that we actually deployed to help the effort to fight the pandemic. Moving on. Just looking at our overview of the whole financial performance, as I said, the system's changed several times during the year. So we had a COVID financial framework, which actually in the year in question operated in two halves. We had a break-even target, and we met our financial performance target. We actually had quite a large surplus, although that was mostly as a result of additional non-recurrent income. So sadly, not a position that will be repeated in every year. I said I'd say a little bit more around capital, but we delivered a huge amount in terms of capital projects, which in itself was quite a struggle, given that we'd got COVID restrictions in quite large portions of the year. And then obviously pressure on services for the whole of the year. We did actually manage to achieve 3.3 million of recurrent savings. That was less than we would normally target in a normal year, but we managed to keep those savings running largely because we'd done a lot of planning prior to the start of the year. I've already mentioned the COVID related expenditure. We did end the year with quite a high cash balance, and some of that was because of the additional income that I mentioned earlier on. So moving on to the next slide. This is just a comparison of the 2 full years that we've had as an organisation. We did used to look at this on a longer term basis, but it gets quite complicated with the merger year, with only part of the GCS part of the predecessor organisation showing in the accounting and the way that it works. But this just shows you a little bit of the movement between 2021 and 21 and 22. In terms of the key things to note about this, obviously there's a very small increase in income, but a much larger increase in terms of pay. And also there was top-up funding, which was mostly related to COVID expenditure that was reimbursed from NHS England. So that just gives you an idea of the overall numbers if you looked at the 2 annual reports side by side. So just moving on. So in terms of where we ended up in the year, as I said, we ended up with a surplus of 4 million, and you can see when you put it alongside the 2021, that was quite an unusual position. We also didn't have any of the odd merger accounting. The 2021 year that you can see there had a very odd entry because of the transfer of Herefordshire services that had quite an impact on the accounts, both in terms of the surplus deficit for the period, but also how much of that related to the Herefordshire transaction. And a new item that we've had in the last couple of years is the impact of consumables. It has donated from other departments of health and social care bodies. That's to do with the personal protective equipment that we actually get direct from the Department of Health and Social Care. And we have to account for that stock. So every time there's a movement in stock, there's a movement on our position, and that's what that 278,000 down at the bottom of that slide represents. So you get to an adjusted surplus position, which is the position that I just reported just now. Moving on. I said I'd say a little bit more about capital. So capital is what we call our big expenditure on big items of equipment, buildings, IT, etc. And this just breaks down how we used our capital programme in 21-22. A lot of it was around estates type projects, as you'd expect, but also a huge chunk there in the purple on medical equipment, and a fairly sizable chunk equal in size to the equipment on IT infrastructure. You'll see starting to come in 21-22, we've got some of the expenditure on the Forest of Dean project. A lot more, if I was presenting this year's figures, it'd be a lot more than that this year. but that was the start of the Forest of Dean project to build the new hospital. £16.7 million is obviously an awful lot of investment, and most of that was funded from cash reserves, which are funded by depreciation, that I mentioned earlier. Just moving on. So on the Forest of Dean, you can see the profile there of what we're expecting in the scheme. You can see what I'm saying about there being an awful lot more expenditure in this year and indeed in 23-24. Obviously, this is a big thing for us to do in terms of our expenditure. It's not very often that we'll be building a new hospital, and of course it's a key part of our capital expenditure for the next 2 financial years, which is the reason for mentioning it here. Last bit from me is that clearly all of the figures that I've shown you are audited. Our external auditors are KPMG. I'm pleased to say that when they audited in June 2022, they issued an unmodified audit opinion and an unqualified value for money opinion. And for anybody who isn't familiar with those words, both of those uns are really good things. To have unmodified and unqualified means basically that there weren't any major issues that came up as part of the audit. So that's it from me. Hopefully I've caught up a little bit of the time, Chair, and I'll hand back to you.
Thank you very much indeed, Sandra. And I am going to move on, although we thank you, Sandra, your brevity was commendable. We're going to move on now to hear from John about the quality element of tonight's reporting. So over to you, John.
Thanks ever so much, Ingrid. And I have got to say a massive thank you to not only Sandra being brief with her finance report, but also for all the money that helped us actually deliver a lot of this work in this last year. And I don't make light of that. I think a lot of the position of the trust and our good standing and the work that we've achieved that we're going to talk to you about in a moment in the next few slides is due to some really good financial stewardship. So thank you, Sandra and colleagues. Right, moving into my first slide, Kate. So despite COVID in 21-22, because it was one heck of a year again, people, in terms of impact on service provision. I've not known as tough a winter, I think, in all my years as this last winter, and it was absolutely down to the diligence and commitment of colleagues across the system, not least our trust, to keep delivering services. Quality was not diminished. In terms of how we managed quality, many of you that are attenders at Public Board and would have read our quality report that was published earlier in the year will see that we provide regular, consistent, high quality, lots of information, quality updates. We always do our monthly quality dashboard, and we haven't failed in any of our submissions to the CQC, our stakeholders. The Trust takes its responsibilities incredibly seriously, as it should. Part of our quality approach isn't just reporting, it's also about listening, it's about taking feedback, having the really difficult but honest conversations and listening to people's experiences of our services in good times as well as, very importantly, in bad times. We got really good feedback from CQC and also NHS England in this last year about our work as a listening organisation and how there was really a good golden thread of the organisation in listening to people that deliver services and use services to make improvements. The next few slides that we're going to get into, we'll talk about our CQC ratings, and we can't really talk about quality at all, colleagues, without mentioning what's happened this year with CQC. We were subject to a absolute range of inspections. I think CQC virtually lived with us from the winter right through into the summer. We had the urgent and emergency care system inspection, which commenced in November, and our urgent care services were re-awarded a good rating. We had the Charlton Lane inspection, which was an unannounced inspection in March that reported in June, July of this year, and very sadly we lost a rating from good down to requires improvement, which reflected some of the significant pressures our system has been under. We're going to talk a little bit more about that in a moment. And then, of course, we had a full core services inspection, which was announced in April and delivered in April and May, which looked at a whole range of our services as a newly merged organisation, and also as our board work from a well-led perspective. So moving into those slides, the great news to talk to you about is, if you look in the bottom right hand corner of that grid, is the good rating overall as a trust. So in terms of our whole opinion, our whole view from CQC, and in how well led we are, and well led relates to what we do as a board and a senior leadership team and how that is delivered across the organisation, we came out as good overall. In terms of overall services, we had good for both our mental health component and our community component. By community component, that includes all the physical health services that we deliver, including our inpatient services. It's just how CQC divide things up. And mental health includes our learning disabilities and autism services. You will see that we got requires improvement in mental health and requires improvement overall for safety. That relates to how well we are able to evidence and embed high quality learning and developments from incidents, complaints, experience. Also reflects the significant pressures that we've faced as a system in terms of staffing issues and service delivery issues. At a lesser level, it reflects some of the consistency issues in making sure we're able to document things and evidence things 100% of the time. Some of that is very much in our gift to be able to address. Some of it will be our work as part of a wider system and wider society in meeting the pressures that services are under. But I'm going to talk a little bit about actions around that in a moment. Next slide. So this again is just a great slide to present, and such a privilege on behalf of the organisation of everybody's hard work across this. And as I think Paul said earlier, this doesn't just reflect clinical staff. This is our clinical staff, our facility staff, our estates, our procurement, our infrastructure, colleagues all making this work happen. So a sea of green, these are all the services that historically were delivered by GCS. CQC were really keen to inspect us for this because they weren't able to reflect a full rating for the trust, hence their focus on this aspect of the trust. And in amongst that sea of green of good, we were really pleased to receive an outstanding award for caring in terms of end of life work. So excellent to see. Next slide. So in terms of mental health services, I say only because it was a big job. CQC only inspected our inpatient services for working age adult and psychiatric intensive care, our wards for people with a learning disability or autism or both, which we know as Berkeley House, and also in March, just before they did the big whole trust inspection, they inspected Charlton Lane. So Wotton Lawn and Greyfriars, our PICU, got a good overall. You'll see in the right hand corner with a requires improvement for safety, and I've spoke about some of the reasons there for that. Berkeley House moved from being previously judged back in 2018 as requires improvement to a good rating, which again was really, really pleasing to receive and reflects all the hard work that people working in the system have done to move that rating up to good. Charlton Lane, very sadly, was reduced in ratings. Charlton Lane as a service has faced some significant challenges. Staffing issues have been very difficult, and service delivery through the pandemic has been a challenge. However, what I do say, and I don't say this defensively because we are very, very upset as a senior leadership team and very, very motivated as an organisation to identify it. There was also a lot of very good things noted in the CQC report about Charlton Lane in terms of compassionate staff, how the organisation deals very effectively with incidents, and lots of good systems in place. There are full action plans already well underway, as you would expect, to address many of these issues, and we are seeking to invite CQC back to Charlton Lane Hospital later in this year to be able to address that. So I will move us on. Quick slide here just to let people know, because I know as stakeholders and good colleagues inside and outside of the trust, these are all the services that weren't inspected. So basically the bulk of our mental health community services, and you will see that we're still looking at ratings from all the way back to 2016 in cases. So we will no doubt be expecting further CQC attention in these areas in the coming year, and we are preparing for that. Next slide, please. So I won't go over this slide again because I think I've really spoken to some of the detail on Charlton Lane there. And again, I apologise, colleagues and stakeholders, that we did lose a rating, but you have my full assurance that the organisation is working hard to remedy that for the good of the people that use our services and, of course, the staff that deliver it. Next slide, please. So few slides talking about our quality approach. If you've had a chance to read our quality report, you'll see a lot of this in more detail. As a trust, I'm really proud that we take a very open and transparent approach. We got good feedback on that from NHS and CQC, and we very look to be a listening and engaging organisation in how we approach quality monitoring. And if we get into our next slide, please. And just briefly touching on this in terms of the more sombre and serious aspect of the work that we conduct, looking at our serious incidents in terms of comparisons to previous years, were relatively similar. I always use this phrase with caution in terms of it's the science of small numbers. So one incident is one too many. In terms of the incidents that have occurred, all have been fully investigated using root cause analysis techniques, feedback freely shared with families and carers and interested parties, with very clear action plans on how to address those issues, full compliance with duty of candour, and working to address these problems, noting that we do work with very vulnerable people who need our services. So it's just to give assurance to colleagues that this is work that we monitor closely and continue to pay a lot of attention to as an organisation, and never rest to improve. Next slide, please. Speaking up, one of the things that we got really good feedback from both NHS England and CQC, and I think it was reflective in the staff survey reports that Paul talked to you about, was our culture in the organisation. A lot of work invested in our values and a lot of work invested in making lots of different routes for people to raise concerns and point out things where we can do better and raise issues, whether they be small or whether they be potentially much, much more serious. You can see in our numbers that our numbers of speaking up cases had reduced in the last year. However, from our surveys of the work that we do and looking at our other channels of which talked there, lots of people are able to freely raise issues in our trust, and it's something that was reflected in our regulators' findings as well. In terms of an organisation being honest and transparent and safe, that is a really good thing to be able to present to you, colleagues. And we've got a nice photo of Sonia there, our Trust Freedom to Speak Up guardian. Obviously the comms tell a story. There's no nice photo of me in there, Kate. We'll have to catch up on that at another date. Next slide, Kate, or am I almost there? Quality strategy. In amongst the work we delivered, despite working through another year of pandemic and challenges, Across the trust, using good co-production and co-design practices, we were able to produce a new quality strategy for the trust. Some of the details there, it aligns very much to our overarching trust strategy, but it's very much based on working over the next 5 years to achieve our ambition of outstanding regulatory status. And we do that not just to tick a box with CQC and be able to wear a new badge, but as a marker of the quality of our services for the people of Gloucestershire. Some real good work within our quality strategy. And again, if you haven't had chance to see it, it's on our website and I would recommend you have chance to look at it. Some of the work in there maps out our roadmap on how we are going to get from good to outstanding and how we can assure the quality of our services. So well worth a read. So our key areas of focus for the year, and those of you that are eagle-eyed and good of memory will say, John, those look very similar objectives to the ones you presented us last year, and you'd be absolutely right, because we've rolled those forward again, because through our quality work, we've determined that they are good markers of quality of care across the range of services that we very proudly deliver in GHC, and the things that you would expect an organisation of our type to be focusing on. So there's falls work there, there's pressure ulcers work there, our endless task to contribute to reducing suicides in the county is there, alongside embedding learning and moving services forward. That's all the slides I've got to present. Thank you ever so much for listening, and I'll hand over now back to the chair, I think, to hand to Chris. Over to you, Ingrid.
Okay, thank you very much indeed, John. And I know that along with the other presentations so far, there will be many things that people will want to explore with you in a few minutes. But I'd like first to invite our lead governor to come and speak to us about the Council of Governors and the role that they've been playing with us within the Trust over the last year. Over to you, Chris.
Thank you, Ingrid. Good evening, everyone. I'm Chris Witham. I'm Public Governor for the Forest District and also Lead Governor for the Trust. And I'll try and give you a brief overview of some of the work we've been doing as governors over the last year. So by way of introduction, as a foundation trust, we have a membership body that comprises public and staff members, and the membership elects people from the membership to represent them on the Council of Governors. And just to, I know many people on this call and watching this presentation will know the NHS Constitution, but for those of you who don't, the NHS Constitution starts with the NHS belongs to the people. And the 7th principle of the NHS Constitution is that the NHS is accountable to the public, communities and the patients that it serves. And it also talks about the way that that accountability works. And for me, some of the work we do as governors with the Trust is about that accountability and making sure that the Trust is representing the people it serves and working for the communities it serves. And it's a great privilege to be part of that work. So our role as governors is to hold the non-executive directors to account, who Paul introduced you to earlier, and we hold them to account for the performance of the board overall. We represent the interests of the Trust stakeholders, so all of the citizens that the Trust serves, and as well as patients, staff, and it's an important part of the overall governance of the organisation. And we also have a role in communicating key messages out from the Trust to the electorate and our appointing bodies. And I think that two-way communication for me is a really important part of the role, both taking messages into the Trust, but getting the messages back out as well. So if we look at who the governors is made up from. So I am one of 13 public governors across 7 different constituencies. We've got 7 staff governors, and they're elected from 3 different areas of staff. We've currently got 2 appointed governors. We can have more, but currently we have representatives from Gloucestershire County Council and Young Gloucestershire. And importantly, the Trust Chair, Ingrid, plays an important part of the work with the governors too. So if we take a look at the membership of the Trust, membership hasn't changed too much from the previous year. It's a total membership of 10,614 members, with just short of 6,000 members coming from the public, and over 4,500 staff governors. And we've got a by proportion of population, we've got a pretty good membership across the 7 different constituencies. So I'll talk a little bit now about the work that the Council of Governors has done in 21-22. I think, as Paul mentioned earlier, it's reporting on the year and the date at which we hold this meeting. My brain has to work overtime remembering what was and wasn't in the year. So we held 5 formal meetings in 21-22 and 2 development sessions. They've continued to be on Teams, so we hold those meetings virtually still, although we're continually reviewing that arrangement and trying to make the best arrangements for allowing people to engage and being able to hold those meetings safely. We've received feedback from the annual appraisals, non-exec directors and the Trust Chair. I'm very pleased to report that was very positive. We've approved and appointed a new non-exec director, and there was a very robust recruitment process, which involved governors being both part of the interview panel, but also some informal groups as part of the recruitment process as well. We've approved the reappointment of 2 existing non-exec directors, and we formally received the Trust's annual report and the annual accounts, which have been presented here this evening. We continue to advise on the development of the Governor dashboard report. So that's brought to each of our meetings, and as different sort of topics of interest are raised, or perhaps focus areas that we need to be looking at in more detail, that report and dashboard evolves and flexes, so some additional information gets added, as well as a really comprehensive baseline of data that we look at as part of holding the non-execs to account. And we've received a presentation from the Chair Designate of Gloucestershire ICS, and we're looking quite closely at the formation work around the ICB and the ICS. And that's one of those things where there's lots of new things that have happened since the end of the financial year. And so I think, like Sandra was saying with the Forest Hospital, there'll be lots more for us to talk about next year with ICS and ICB, and how that develops, and the important role of governance across the system as well. We've also received and discussed the results of the NHS staff survey that was mentioned earlier, and the CQC Community Mental Health Patient Survey. I'm really grateful for the amount of time that staff from the Trust give us as governors to go into a lot of detail regarding things like the staff survey and other reports. And that's a really important part of the work we do. We've endorsed the Trust entering into the construction contract, and it was it's been fantastic to see the construction of the new Forest Hospital commence. I live just up the road, so I get an almost day by day kind of rolling picture of how it's coming along, and that's a very exciting project for the organisation. We continue to receive presentations from the non-exec directors, so we have holding to account presentations at each of our meetings, and we've now done a complete cycle of all of the committees, so we're now revisiting some of those areas, and that's helping the governors get a more detailed view of all of the work across the whole organisation, and helping us feed into that piece around holding to account. And we've started to receive a monthly schedule of trust engagement events, and this is something that we're trying to get back into following all the restrictions from COVID, and it's really great to be able to start getting back out and meeting more people and talking about the work of the organisation. We've participated in National Governor Forums. There's an excellent National Governor Conference run by NHS providers, and we've also had training workshops from NHS providers too as part of their Govern Well programme, which really very valuable in helping us governors understand the role and understand how we can be effective in that role. And we've been part of the evaluation process, which approved the appointment of KPMG as our external auditors. So if we look to the year ahead, we will continue to seek assurances around trust performance, and we've just had an excellent quality presentation, and believe me, there's an incredible amount of work that goes on behind all of those slides to really ensure that the trust is working in the best interests of patients and delivering high quality care. We're continuing to enhance our membership strategy, and we've had some. We've been developing some new engagement resources. We're also in the process now of creating a deputy lead governor role, and part of that role will have a specific focus on engaging more with our membership and appropriately growing our membership. I think it's important to note that as an organisation, we don't see a large membership necessarily as a positive thing, and focus more on the quality of the engagement with our membership. That's a metric that's viewed differently across different trusts across the UK, but I think it's obviously great to have a large membership, and I would encourage people to become members, but we want that to be a quality relationship, and we want people to feel they have a part to play and a voice within the organisation. That's really important too. We're going to build on ensuring the council represents the interests of the people, and that is both physical health conditions and alongside the mental health and learning disability services as well. As Paul mentioned, 106 services, and it's really important that all of the patients and the citizens, families that are wrapped around those patients are represented and have a voice in how the organisations run. And we're going to continue to promote governor attendance at local and national events, and I think that's going to be a lot more. That's going to be really important in the year ahead as we start to work differently with other services and providers within our system. So I think that brings my little run through to an end. And just before I hand back to Ingrid for questions, I just want to say a huge thank you to all of our staff. It's a real privilege to be a governor and to get a glimpse into the work of the organisation. And I know so many people across the organisation in so many different roles, you know, give a tremendous amount, not just over bank holiday weekends like last, but day in, day out throughout the year. And on behalf of everyone you serve, a huge thank you. It really is a great organisation.
Thank you very much indeed, Chris, and likewise our gratitude to you and all of our governors for the immensely important work that you do with us through the Trust. Right, I'm now going to throw the floor open to your good selves to take any questions that you may have about the presentations you've heard this evening. While people are thinking, I think Bren McInerney has left us now. He had to go to another commitment, but he did send us some written questions, which we will reply to in writing to him. One was regarding the way we're looking after the well-being of our colleagues, particularly during the cost of living crisis. And secondly, he was asking about the thing we're most proud of around our equality, diversity and inclusion initiatives in the organisation. And we've got a lot we could say on both of those things, but we will refer back to Bren in writing. Okay, Chris, I can see your hand up.
Yeah, so just to respond to that point about looking after the staff, it's been a topic we've talked about quite a lot with the governors, and I think one thing that really stood out for me amongst a whole range of good practice was the way that the Trust supported colleagues through the outcome of Brexit, and not to make any comment about Brexit, but the process by which some of our overseas staff had to apply for indefinite leave to remain, or different visa statuses or working statuses, and I think the work that Neil and team did really exemplified understanding the heart of the problem and doing something beneficial about it to support all our colleagues who were impacted by that. And that's just one thing where we've seen really great practice around that. So thank you, Neil and team.
Thank you, Chris. So I can see Joy, you have your hand up. Would you like to come in now?
Thank you. I'd like to just raise something in connection with the CQC inspection and the issue of safety requiring improvement in inpatient settings. And very sadly today I've attended an inquest into the death of an individual who took her own life in Wootton Psychiatric Hospital, and so it's very much at the forefront of my mind, and where I guess the question is, are you continuing to look into what appear to be repeat issues? For example, what was raised today as trying to locate the care plan of the individual that should have been created when she was in psychiatric hospital. This is something that I heard raised back in 2015 at another inquest where an expert witness was brought in by the coroner, an independent psychiatrist, and again being unable to find the care plan, and I think the issue of care plans and risk assessments seem to be matters that keep coming up, and whether there's a piece of work looking into trying to see those repeat issues that appear to be happening, and certainly in terms of risk assessments as a recent and actually current patient under the recovery team, I know I would really question the thoroughness of the risk assessments that sometimes exist in patients' records. I know there's significant information that isn't in there that has been in previous risk assessments, and so I guess the issue of care plans and risk assessments, and whether there is a piece of work ongoing, and if there isn't, whether there could be a piece of work looking into those issues, because there does seem to be a sense of these issues repeating themselves.
Thank you so much, Joy. And, of course, any of these incidents are all personal tragedies for the people and families involved. And the Trust, as John said in his presentation, is determined to learn from these sorts of incidents and really ground that learning in reality. So thank you very much for the points that you've made. I don't know whether any of our executive colleagues would like to respond to the specific points about care plans and risk assessments and how consistent those are.
I could take that one. There is always ongoing work, especially after an incident, to look at where there have been irregularities or inconsistencies in care or documentation of care, to continually strive to improve them. There are regular audits around that work, and there is ongoing development work around that. There's also the Community Mental Health Transformation Project as well underway, led by ICB, or led by the Trust, working with the ICB, should I say, that seek to address issues in the community as well. So as I mentioned earlier, that work continues, and of course it's an absolute tragedy when problems are found of such an awful nature. I'll stop there.
Thank you very much, John. I'm not seeing any other hands. Okay. No other questions. Okay, in which case I will draw the meeting to a close by saying again, thank you all for being here. Thank you to my executive colleagues for the presentations that they've given to you. I hope we've been able to make clear to you some of our achievements and some of our ambitions, as well as some of our ongoing challenges that we're still working on. I hope we've been able to give you really good assurance about our stewardship of your money, public money, and the way in which we are continuing to deliver high quality care, which has been tested and evidenced through external bodies such as the CQC, as Paul mentioned in his report. The workforce issues are really, really hard in the NHS, and therefore the external staff survey showing that our colleagues do feel respected and supported is incredibly important to us, as are the direct feedback that we get from the people who use our services. And mention was made this evening of the National Mental Health Patient Survey and some of the good outcomes for the Trust from that as well. So I hope that we've been able to give you a good overview of the work we did during last year. As ever, we'd be happy to take forward any further conversations outside of the meeting if you would want to pick up particular themes or issues with you. But none of this would be possible without the support of our members, our governors, our experts by experience who do a huge amount of work with us in the Trust in many, many ways that haven't been talked about this evening particularly, but they really do count. And of course, we couldn't do anything without our partners, both statutory partners and third sector partners. They're hugely important to the work that we do. Most of all, a big thank you to our colleagues in the Trust. They're the ones that do the frontline work, and without them, we would be nothing. So those of you that are here, we so appreciate your work and thank you for everything that you do. I'm drawn to the words of Justin Welby from yesterday. In his sermon in Westminster Abbey, he said, "Those who serve will be loved and remembered." Well, amen to that. Thank you all for what you do. Good night, everyone.